So the catheterization lab is a procedure room in the hospital where we perform cardiovascular procedures. We use X-ray fluoroscopy to get high-definition images of the blood vessels of the heart and of the peripheral vasculature to help us diagnose coronary artery disease and perform interventions if needed. Coronary angiogram is the gold standard for diagnosing coronary artery disease. It provides us definitive information on what's going on inside the blood vessels at real time. And the advantage of that is we can also go ahead and directly treat any significant blockages that may be there right there on, then and there on the table. So in terms of the procedure itself, the first thing we do is give our patients some sedation, moderate sedation, to make sure they're comfortable on the table. They won't be fully sedated, but they'll be able to feel comfortable, and also, it's important for us to be able to talk to the patient if needed during the procedure. After that, we also give some local anesthetic to the skin where we access the blood vessel. From there, we access the artery in the body. Either it's usually the right radial artery. If not there, it'd be one of the common femoral arteries in the groin. And we take a catheter up to the heart. And then under X-ray imaging, we take some pictures to see how the blood vessels fill and to see if there's any significant blockages there that need to be intervened on. If there is a significant blockage there that needs to have a stent, we can go ahead and fix that right then and there. What we can do is advance a coronary wire or a small wire through that tubing and advance into the distal part of the blood vessel. And we use that as a track or rail system to advance balloons to stretch out the blockages or plaque, and then also put in a stent to open up the blood vessel. So the types of patients who'd benefit from a cath lab procedure include those patients with chest pain who've had an appropriate cardiac workup, patients who come to the hospital with chest pain or acute myocardial infarction, which is commonly known as a heart attack, and also sometimes patients who have heart failure or cardiomyopathy. In general, we ask patients not to eat anything before their procedures because they do get sedation. And we also ask them to come a few hours before the procedure as well if it's an outpatient procedure. In terms of the recovery time, usually, again, it depends. If patients have a simple procedure, they may go home a few hours after. If the patient has a stent placed or it's a more complex procedure, the clinician may decide to keep the patient overnight and observe them and then discharge them in the morning.